Hello, my name is Kirk Allen. I'm with the Edgar County Watchdogs, and we're going to address in a video response instead of an article some of the things that happened at the Ford County Board meeting last week. I think it's important to get the information out there as fast as possible, and we're going to tie our responses into that video directly to some of the questions and comments and lies that came out during that meeting. I think you'll enjoy. What we found interesting was what the Ford County chairman had asked Mr. Jensen, commonly referred to as the preacher man, asked him to show up to that board to provide the board some help in informing them of his experience and what he was learning in regards to what's going on with the Fort Iroquois Public Health Department. He specifically stated he didn't want personal views or opinions. That's one to note throughout the rest of this video. And interesting was Mr. Bowen wanted Mr. Jensen to basically outline and express his fact-finding. What facts did he find in his mission, or what he referred to as a fact-finding mission, and we thought that was some interesting terminology under the circumstances, and we'll go into detail on that.
I lived in Ford County all of my life except for 4.5 years while I was in college. And that 4.5 years was spent in Springfield, Missouri. I have nothing at all to be ashamed of in regards to Ford County, and part of the reason I came back here. In fact, while I was away, I remained a citizen of Ford County and the state of Illinois. I was one of the few people who could come into the state of Illinois with a driver's license that didn't have a picture on it, and hand it to an officer, and they would understand completely that I didn't need a picture on my license because of the residency issue. I am a licensed minister. I am not pastoring at this time. I am a member of the Board of Health. I have been a member of the Board of Health for 27 years. And as far as I know, when it comes to health board members, I am probably the oldest, longest-serving Board of Health member that there is. In that 27 years, I have seen different chairmen in different counties, and I have to tell you that this is the first time in that whole period of time that we've ever had any kind of a discussion such as this. We did once before in Iroquois County have a situation with several board members, and that involved fun.
One of the things we really got a kick out of from the preacher man was the comment he said, there's nothing to be ashamed of. He's done nothing to be ashamed of. This is a stack of emails. There's over 100 emails, correspondence, some of them illegal correspondence because they violate the Open Meetings Act. And what's ironic in those, Mr. Jensen takes input from Carrie Hagan, that's the great bookkeeper that wrote the bad checks and ran the account negative balance. Those emails she sends to Mr. Jensen, and he references a topics forum where he gets his information from. I wonder if that's the fact-finding that, if the media did that kind of fact-finding, what his response would be. Topics is probably the most disgusting thing that's on the internet, yet there's no accountability at all, but people get on there and say all kinds of things. And Mr. Jensen, in this great fact-finding mission of his, he actually insinuates in an email, and we will post a copy for all of you to read, he insinuates that they should use information that's in that email regarding an arrest of an employee's family member as a way to influence removing that person from the health department. And he says he's worried about the health department surviving, and we don't want to destroy the health department. I would say those actions themselves is a pretty good indication it's being destroyed from within, if that's the leadership that we're dealing with. Mr. Jensen references that he was on this board for 27 years. For those of you in local government, 27 years on one board, what does that tell you? Either he doesn't have anything else to do, or he really loves his position there. Considering it's a position that, doesn't get paid. Oh wait, I digress. They did get paid. The statute says they're not supposed to, but then you'd have to read the statute to understand that. And that comes back to probably some of the fact-finding mission. It might help to go right to the source. And in doing that, you might find out you're not allowed to pay yourself, Mr. Jensen, nor are the rest of the board members. That's part of why Iroquois County took action against their board members. They were doing things outside the statute. One of the things that's really interesting with this 27 years of experience, he stated he's never had an issue to address the board like they're addressing the board now. Never had these problems. Mr. Jensen, has the previous administration of that health department ever taken Illinois taxpayer money and gone across state lines and spent it in direct violation of the statute? That's probably why we haven't had these issues, is because it hasn't come to this before. But under your great wisdom and leadership and all your fact finding, you determined you're going to go spend the money to figure out whether or not you can do it. That doesn't make a whole lot of sense, and that would be an indicator that 27 years just might be too long for you to be on that board, sir.
You see, the health department was given funds by the tuberculosis board when it was closed down. And it was given with the stipulation that we keep that as a hedge against a epidemic outbreak of some disease or a resurgence of TB. And we have kept those on file and have earned interest. We were allowed to use interest off of it. And it makes our financial sheet look a little better than sometimes others do. And for that reason, there were several Iroquois County board members that felt that they should be able to obtain that money. Now, I'm not an attorney. I'll leave that to Matt and his fellow gentlemen that work in that particular area of the law. And therefore, please understand that, and understand that when I'm speaking about anything of a legal matter, it is basically an opinion, because I am not an attorney. However, when I came on the board, I got to talk to both the older members from Iroquois County, and I got to talk to the members from Ford County. And I was wanting to learn how it was structured. Because in some counties they have a health department, and in this particular instance we had a bi-county health department. And there is a great difference between the two.
One of the comments, Mr. Jensen, you stated you wanted to know the structure of the health department, and you were talking to the board members. I didn't hear you mention anywhere reading the statute. Nowhere at all. You talked to the board members to see how it was structured and how things were put together. The statute's the best place to start from, because that's your rule book.
In a county health department, the county board more or less has say over what is done with the funds that are allocated to the health department. But our state, in its wisdom, set up a system where the two counties both had equal representation on the board, because there's two counties, and Mr. Kopis brought up, well, I don't understand why we're paying more than Ford County. Basis for that is population, because the cost is divided per person of the district, not of the county. You combine the two counties, you take the cost for the health department, you divide it by the number of citizens of those two counties, and that will give you the basis for why one county pays this much and the other county is paying that much toward the health department. But the health board itself is the one in a bi-county health department that oversees the running of the health department. We submit annually, according to the statutes of the state of Illinois, as I understood it, and as I was explained to me back those years ago, and the county has to collect it. They are obligated by law to do that. So both Ford County and Iroquois County receive that money, and it goes into a health fund in either of the county's treasury departments, and generally it's in the county where the main office is kept. So if the main office was kept in Ford County, it would be your county treasurer that would be having to have a fund to hold those funds in. And then our treasurer goes to the county whenever we have expenditures to make, and they give a voucher, remove that money. And the county treasurer has to keep track of how much money is coming out of that fund. So they kind of give a report back to us, and we're reporting to them. And the county boards, both of them, have to annually approve our county budget. Now it seems as though with this particular chairman in Iroquois County, he believes that he should be able to tell us what we're to do with the money. And not all the money that the health department has that goes into our fund comes from taxes. We run programs through grants. We receive money from grants. We have to run those programs in accordance with the stipulations of the grants, that is, the people who has given us that money. And therefore, we have to follow their instructions.
Mr. Jensen, you made an accusation that Mr. Kopus is wanting to tell the board where to spend their money. I don't know that I would determine it that way or qualify it that way. My speaking with Mr. Kopus doesn't reflect that at all. But what he did want to address is that the money is being spent appropriately. And going into Indiana is not appropriate, nor are some of the other expenditures that we're going to get into and expose. And we've got the evidence. We have the FOIA information that proves what we're saying. I challenge you to disprove what we're saying.
And our illustrious media came out with statements like we were giving the health department members and employees gift cards and stuff from Walmart, Casey's, so forth. And we have to keep track of all that, and we have records where all those come from. Because like with the Illinois Department of Transportation, who says in this state that you, as a parent, must have a child restraint seat or a child that is of a certain age and a certain weight, and if you are not able to afford one of those, how are you going to comply with the law? Well, in their wisdom, they set up grants that are overseen by people within the state, and our health department happens to be one of them. And those people can come to us, and we take down the information and check it against the guidelines to see whether or not they are eligible. And so then, if they are, we're not allowed to give them money, because that doesn't mean that they'll end up with that car seat. So we've made arrangements to give gift cards for things like that. We also have programs with the elders who take care of grandkids. We have numerous different programs, and all those gift cards can be traced back through that. After the media put out all this, the Eastern Illinois Agency on Aging did an audit of us. They do that once in a while anyway, but I don't know whether this was early or not, but they did an audit. They found nothing at all. They found that we were doing exactly what we were supposed to be doing, and those cards were going where they were supposed to go and for the purposes that they were intended for. But our media, in its wisdom, when this was all put out to them, they didn't check with the health department. They didn't check with any of the board members to find out, well, why is this being done, or where is this going, or, oh gosh, the health department's terrible. They're just spending your money for any willy-nilly thing that they want to spend it for. When in fact, that was not the truth. The truth is that we probably are more audited by any entity in the state of Illinois other than banks themselves, I think. Because each and every one of those people who give us a grant, they have not only the opportunity, but the requirement, generally, to audit us. I can think of one other group of people that perhaps would be more audited than what the health department that is, and that's a pharmaceutical company. Because you see, I worked as a consultant to a pharmaceutical company at one time. And during that period of time, I saw more people coming in to audit, and they would come in groups of 25, 30 people at a time for one group to audit. And there are laws in this state that regards our medication. There are laws in this state that require what hospitals and health departments and doctors' offices can and cannot do. And to reply to you, part of your question, sir, is so why so many papers? We're required to keep a document for each and every person that we serve. And why does it take it so long then to get to people who want to FOIA us? Because there's also a law that says I cannot give, the health department cannot give your personal information to someone else without your approval. And so therefore, not only do we have to go back through all the boxes that we have of those records, but we have to then go through and do what they call redact that information. That is to remove it so that they cannot see it. And that's according to law. Now, I'll admit, I'm just a, country boy, raised in Piper City. That certainly in the big city. I lived in this big city for 4.5 years, and I really didn't much care for living in the city. My wife was born in Chicago. She thought it was all right, but I felt it kind of confining. And so the whole thing of the matter is that out here we have trust in people. We trusted Dr. Pickering. Most of the people on that board, when I came on, told me about Dr. Pickering, and as I watched him over the years, I saw indeed a man of integrity. I saw a man who was educated. I saw a man who was trying to do the best for the populace of Ford and Iroquois County. And I saw a pattern to what he did.
Mr. Jensen, you commented about the importance of following the instructions on the grants. I'd love to have a sit-down conversation with you and the rest of the board on that topic alone. When it comes to following instructions, and I've written quite a few grants, and we've gotten several $100,000 just in our own fire department on grants. And over all my years and all my experience, both in the military and in the business world, one thing I know about grants: you can't spend the money outside the scope of the grant. You can't do it. Now, I digress. You guys did. And nobody seems to think that's a problem, but you even justified why to do it. And I'd like to talk about that for a minute. You stated when people didn't qualify for their car seats, then you used the gift cards in order to get them their car seat because the law said that those kids had to be in seats. Some folks will say when we're questioning whether or not the car seat issue is, good or bad, we don't like children or we want them hurt in accidents. No, that's not the case. We just know that when you have a grant for gift cards, which the aging grant relates to gift cards, you can't use those gift cards for some other program, like buying car seats, which you've acknowledged you did. That violates the scope of the grant. That's a fact. Most would call that grant fraud. You call it good service to the people. Well, there's two different perspectives, but we'll stick to the statutes and we'll stick to the contracts that say the funds won't be spent outside the scope. That particular grant, I've got that one right here. This is from the Department of Transportation. You claimed that people had to qualify. The technician will purchase seats that meet federal standards with all funding received from the grant. They will purchase the seats. They keep those receipts. They turn those in, they get reimbursed. That's how that grant operates. This grant has no requirements of certification or being authorized or meeting any minimum guideline. The standard is, do they need a car seat? It's pretty cut and dry. It doesn't allow you to go and get another grant money and use it for that program, because now you're cheating the other program. The one you referenced, the aging program, it's interesting in that stack of emails. We've got your email that included an audit from the grant regarding the aging program. And you guys have bragged in email correspondence, which violated the Open Meetings Act, You bragged about the ability, or that there was no issue with those grants. There was nothing found wrong. The aging grant, what was interesting with that, you alluded to the audit that took place in those emails, and we'll post that document as well. And in that audit, the limited scope that they looked at, they found nothing wrong. Did you tell them you used gift cards to buy car seats? Or was that disclosed from the auditor? We'll find out. I suspect they weren't aware that you were using gift cards outside the scope of that particular program. In regards to the tobacco grant, and there's been several of them, one of the grant applications, or the actual grant document submitted to the state for grant compliance, being that you guys get audited so much and looked at so closely, it outlined requirements of who's working on the grant, how much time they're spending on the grant, and through that process of doing FOIA requests, which I know you guys hate so much, it's part of your legislative duty though, what we found was fraud. Fraud in the form of there's people being referenced in those grants, earning income, or you're telling the state you're paying a portion of their salary from those grants, and they've never worked on the grant, sir, ever. And I can prove it, and I challenge you to let me present that to the board. Give me the time to present, just like you had the time to spend running your mouth that didn't really address a whole lot that the board was asking. I didn't see one document that you brought forward from your fact-finding mission. Don't you find that a little odd? Even odder in this situation on this tobacco grant issue, or the whole grant issue, this particular tobacco grant went to Julie Clark. She was listed on there as a contractor. She was the contracted person to handle that grant under the name Strictly Business, another one of those businesses that Julie Clark operates. I did a FOIA, those miserable pesky FOIAs, and in that FOIA I asked for a copy of Strictly Business contracts since 2000, I believe. That was back in April. I'm doing my homework. That's that part of that fact-finding mission thing we do. 2000 to current, all the contracts came to me in one envelope, and they stopped at 2009. I believe it was in 04, 5, 6, 7, 8, and 9. There wasn't anything for 2010, nothing for 2011. Yet the 2011 smoking tobacco grant, I forget the exact terminology, we'll post a link so you can see what that is. It lists Julie Clark as the contractor, Strictly Business. So I did another FOIA. I asked for the contract that the grant reference that you folks told the state was the contractor for that program. There is no contract. So is that not a lie to the state when you report that there's a grant contractor and you have no contract? I also asked for the bid announcements for that contract that was issued to Julie Clark. Gosh, no bid announcements either. So here we are again, no bids, no notices to anybody, and an inside acquaintance just happens to get that grant too. Just like the solar panel project, even though you had a bidder who won the bid by law, who should be suing your butts off right now. And the only reason he doesn't is because he doesn't want to ruin things within the county and bring it down any further than it is. I suspect he's hoping that everybody does the right thing and removes Mr. Corbett from his position.
He didn't try to say, oh, well, you didn't quite put that motion right. He'd say, okay, now, this is the motion, and then he would restate it in the proper way. He didn't come out and say, well, you have to dot this T and cross that I just so. Because you see, those things weren't quite important to him. What was important to him was the care and the service to the citizens of Ford and Iroquois County, and getting it done in a manner that would save them money. Now, part of the way that he accomplished that was to make our department one of the premier health departments in the state of Illinois. Our department was either the first or one of the very first health departments to attain accreditation. You say, well, what's accreditation? Well, what's accreditation in school? Some people think it's a lot, some people think it's nothing. But for a health department, accreditation means that we are able to get certain funds that we pay as taxes to the federal government that other health departments can't get. Would you rather be a citizen of a county that pays money into the federal government and then doesn't get that back in services? We set it up where we could get that funds back. And we have more programs to serve not only our young people, but our elderly people. But since this whole thing has started, I have seen inequities. I have seen people telling mistruths. You know, and to me, a mistruth is anything that is not correct. Some people tell a little lie and it's just a little white lie. Not to me. If it's a lie, it's a lie. I don't care whether it's white, black, brown, what color you want to apply to it. It's still a lie. And my wife is even worse about that. She wouldn't have put up with me all these years if I was the kind of person to go around and telling a lie. Now, I might tell you a long story, and I'm long-winded, and I'm sure Eleanor can tell you that, and some of the other board members, and perhaps some people here. You get me to talking, and I'm a preacher. I'll talk, and I'll tell you everything that I know. But when I pointed my finger in that Iroquois County chairman's face and told him that I didn't like a liar, it was because I had discovered two that he had told that were pertinent to not only the health department, but Mr. Copus. And that didn't please me at all. Since then, in looking into things, and you talk about, I've researched the new members of the Board of Health, sir. That is correct. I even researched you too. I found out that Mr. Kraft at one time worked for St. Mary's Hospital, or not hospital, St. Mary's Church and School. And then he was let go. Doesn't tell me for what reason, but I'd be very interested.
Since you mentioned where I used to work and the fact that I was let go, that just shows that your massive amount of research consisted of topics. And I don't believe you looked at it, but it's probably a couple employees at the health department that looked at it and gave you the information. The reason I was let go, as you like to put it, because down here in Edgar County there's lots of intimidation with public officials and other people that when they don't get their way, they like to see how they can intimidate and withhold money, and that's exactly what happened. I was going to some animal control meetings. The people in the Humane Association were trying to get animal control transferred to the Humane Association from the county. We put a stop to that, and people didn't like it, and they just happened to be the same people that were donating money to the school and the church, and they threatened to withhold money, and therefore I no longer work there.
Because most churches are looking for janitors, for people to help them maintain a facility.
Would you like me to tell you why?
That's up to you.
You brought it up.
Yeah, really.
I'll be glad to tell you why.
Mr. Copus should be here to defend himself too.
I'll be glad to tell you why, and I'm not ashamed to say it. When I first started,
I think this is irrelevant. Doesn't everyone else?
it's not irrelevant. He brought my name up.
Come on, guys. Let's get
When I first started doing what I'm doing now,
If the board
I
wants
showed up to an animal control meeting in the county, and the donators to the school
It's his
told
podium.
me that they didn't want me to go to the board meetings, so they fired me because I went to the meeting.
It's his podium.
So don't bring my name up anymore if you don't want to hear it.
Right.
Well, don't bring my me when in fact you don't know much about me.
We've got the emails right here. You defamed yourself.
No, I didn't defame myself. You know,
Taking
I may
part-
not be
taking part in illegal meeting.
I may not be perfect in your eyes, sir, but there was nothing that was done that indeed I would be ashamed of. Not that any other person in this room might not have done under the stress and the circumstances that this has all brought about. And I have found links between people that Mr. Kopus is putting into various positions. He appointed the mayor of Anarga to a board on the hospital.
Can I refocus you just a
Sure.
I think so.
Let's get back on the Board of Health and your thoughts.
Yeah, because Focus isn't here to defend himself.
My thoughts there are
The
that
minister, you should
there is a
know.
great injustice being done to the Board of Health by the media, not researching both sides and getting the full story before they publish anything, by the fact that people are making things up at times and making accusations that are unfounded, and by the fact that there has been so much of this gone on that it is actually hurting our department. Mr. Kopus has said that he wants to destroy the health department. He is full square running ahead to do that.
That's hearsay.
Well, let's keep some of the stuff that we hear
Okay.
out and
The health department, I believe, is one of the premier health departments in the state of Illinois. And I believe that it has served our communities and Ford and Iroquois County quite well. I believe that you're going to be hard pressed to find another health department. As far as our administrator goes, Dr. Pickering was the man that brought him in. Dr. Pickering kept him for quite a period of time. Dr. Pickering saw what he was like, how he worked, how he interacted with the people. And Dr. Pickering did not let him go. Dr. Pickering recommended him to the board. And so the whole picture was in regards to a resume. We didn't have to look at a resume. Dr. Pickering, whom we trusted greatly, said this man's got the credentials, and there were some on the board that actually acts as him, and no, I didn't, because I had been called away at that time. I missed that particular meeting. But here was an individual that met all the criteria that Dr. Pickering felt was needed to run the department. Now, I have to tell you that Doug and Dr. Pickering have two different styles of management. Dr. Pickering liked to get into Springfield to find out what was going on with health laws in regards to the state of Illinois. As a matter of fact, he was asked by the director of the health department to help put together the legislation that would outline what health care through our health department system would be in the state of Illinois. Now, Mr. Corbett is a different person. He's more hands-on at home. He likes to get out with the people, likes to find out what's going on. He likes to work in a manner that he can see. And that caused some friction at the very beginning. And I think it's still causing friction. Because Dr. Pickering had given over authority to certain people to do certain things. And Doug now has called that authority back in. That don't bode well. Some people voted very well with because they were glad to give it back to him. Other people weren't so happy. And so, in my estimation, we would be poorly pressed not to keep Doug Corbett as our administrator. Now, I'll admit there's some things that he does that irritates people. And it's because he's a different personality than Dr. Pickering. They're looking at him and they're wanting Dr. Pickering. But the next guy we get in could be even worse. He may not even have some And so I'm telling you today that if it were up to me, I would vote to keep Doug Corbett.
We're going to change gears here a little bit. Mr. Jensen, you talked about Dr. Pickering and how great things were under Dr. Pickering. You referenced that Mr. Corbett, I believe the term was, worked under Mr. Pickering for a period of time. What's interesting with that statement, by all indications, there were a couple other people that applied for that job, and those folks actually were selected ahead of Mr. Corbett, if I do recall. And we've got some folks that have confirmed that from within the organization. Neither one of them took the job, and I think the term was, you better take this guy because I'm out of here. Now, I may be all wrong on that, but I don't think so, and we'll be doing some interviews in the near future to confirm what we've already confirmed with multiple sources. But as far as working under Mr. Pickering for a period of time, Mr. Corbett claims he came directly from the Perry County Health Department as the administrator. That's on your website, sir, which he claims to be the administrator down there, and we have proven that is not the case during the years he claimed he was. That would be a lie. Remember that thing about little truths or half-truths, or no, you said it's either a lie or it's not. Well, that would be a lie, Mr. Jensen. Would you agree? Mr. Jensen, you made a comment you didn't look at Doug's resume. Personally, sir, that in itself should be enough for you to resign. Because you made another comment that everybody kind of laughed. They were in shock, and the more you think about it, the more disgusting it is. You're concerned about selecting an administrator, and you said the next one might be worse. Well, that would fall back on you, sir, because if the next one's worse, isn't that your responsibility to make sure the next one's not worse? The way you might do that would be to look at the resume, at least read it in that great fact-finding mission that you're doing so well right now. And by reading the resume, how about follow up and contact those folks? Does anybody else find it really odd that Mr. Corbett refuses to turn over his resume, even after the state's attorney has directed him that he must do it? He's not doing it. So now you have an administrator that is knowingly and willfully refusing to comply with the law. The Freedom of Information Act specifically requires him to turn that over. There's been no exemption cited other than the whole Public Records Act, which makes no reference of a resume being exempt. Yet you, sir, sit on the board and have not taken any action to require him to comply with the law. But that would be a consistent pattern, because you, sir, haven't complied with the law. Indiana is an example. And it's a twofold problem, because when you went to Indiana, you actually quoted, and I think this is a pretty close quote, profit margin. That was in reference to the grants. You're going to use profit margin in that seeking of going to Indiana. Sir, I would contend you need to resign. You're not allowed to profit from grants. In fact, our government is not supposed to be in business to earn a profit. We're supposed to provide services. Now, if there is a profit, reduce the people's taxes. That's how it's supposed to work. It's called a republic. We don't use profits in that means. We reduce our taxes. When we're done reducing the taxes from all those profits that we've got from these grants, which actually I think even interest you're required to turn back in if you're drawing interest on a grant. You're not even allowed to keep that, but you've justified the spending of quote-unquote profits. Either you're taxing too much or you're charging too high a fees for your service. You made the statement, we're thinking outside the box in relation to going to Indiana. Well, sir, I would contend that if you first think inside the box, you would find out whether that was even legal before you spent a dime. But you didn't do that. And you've actually acknowledged that. The statute specifically says, and the heck with your bylaws, that doesn't matter what they say. The statute is what matters. It specifically says you can only operate within the boundaries of the counties that is made up in, which would be Ford and Iroquois County. You can't go beyond that. And in the two-step shuffle, or as you like to call wordsmithing, you justified spending money outside of the county. and you reference the grants and people from living some other area, and they send them down and they need health care. That's not exactly what the statute was referring to, sir. It was talking about the operation of the public health department. We understand that someone might come in that's not a resident of the county. It says nothing about the customer or the patient that comes in has to be from the county. It talks about your operation. And yes, you may have other intergovernmental agreements, which are encouraged by our Constitution. You probably haven't read that in a while either, though, but we'll get to that later. You're not allowed to spend money outside the scope of the grant. If the grant references a program that involves other grants or other counties and is tied to other counties, that is fully allowable within the law. That program is not what's at issue here. That's not the question that Ford County board member asked you. He was looking for a simple, did you get direction, yes or no? And the answer is no, you just did it. And you didn't read the statute, just like you didn't read the resume. But you checked up on us. That's the fact finding you do. Well, we're going to throw some more facts at you. You know, Mr. Jensen, this whole deal going to Indiana and hearing you try to justify it, how you squirm your words together to make it sound good and talk about delivering those services. You made a comment that you never found out whether you could go over there or not, and then you implied that in order to find out or even apply for a license, you had to have an Indiana address. You know, you couldn't find the answer. The answers are on the internet. You can go to the internet and go to the Indiana state statutes, and it outlines the requirements and the guidelines for setting up health departments. I'm not sure. Oh, I know what it is. We're back to that fact-finding stuff. I guess there wasn't anything on topics that you could defer to, was there? It's a simple process, sir. It's called Dillon's Rule. Your state's attorney made a reference that there wasn't anything in the statute that says you can't, but there wasn't anything that says you can. We dealt with that right here in Edgar County for over 9 months. Do a little fact-finding and look up Dillon's Rule and see if you can comprehend that. It's part of our constitutional powers. You only have the power given by law. There's nothing in the law that gives you the power to go over to Indiana, therefore you can't, no matter how bad you want to, no matter how good it might make you feel for serving the people in Indiana, or how much profit or revenue you might bring back to this state. If the law is silent, you don't have the power. And that's one of the things that we're finding within our organization everywhere we go, is folks have lost sight of that. You only have the powers that are granted. It's called Dillon's Rule. It's very easy to look up, and it's actually pretty simple to comprehend. When the law is silent, you don't have the power to do it.
Board members, you got any questions for
When the decision was made to go to Indiana, I looked at it as a novel idea in an attempt to gain new revenues. Was that ever brought to the Health County Board before we spent money in Indiana?
You mean the Board of Health?
Yeah, sorry.
Yes, that was brought before the entire board. We discussed the various aspects of it. We were discussing how to go about finding out whether or not it could be done. Doug had contacted the State Department of Health to get information from them in regards to what they knew about the particular subject. And they said, well, they really didn't have anything in their files in regards to having a satellite office in another state. And so we suggested that we try and find out whether we could even be licensed in Indiana, being from Illinois. And the whole concept of it was that rather than try and raise people's taxes, because everybody in government's hurting right now because we're not getting paid like we have to. Rather than raising the tax levy, which we have the power to do, we would look for an alternate means of replacing that lost income. And one way of doing that was to open a satellite office over in Indiana in a 4-fee service. And that means out of those fees, pay for the office, out of those fees, it would actually pay for the people that are running that service over there. And out of those fees would be income coming back in to the department. There would actually be kind of a profit margin. And therefore, with that amount of money coming back in, we would not have to talk about raising the tax levy on Ford and Iroquois County to replace lost funds. The thing all seemed to me to be fine, because it's thinking outside the box. Is we want someplace to try and do something for the citizens of the Bi-County area that we had no other way to do it.
As I have read the articles of the structuring of the Fort Iroquois Health Service, it said that the monies could be spent in Fort and Iroquois County. Did you ever consider changing those bylaws to allow yourselves to go to Indiana?
Well, I wasn't the one that was the president at the time of looking at that, and I didn't take a look at that particularly myself. I don't know whether he did or whether anyone else did, but as it was presented at that time to me, it all made sense. And I knew that, first of all, we had to find out whether we could even do it. And we never got to the point where we found out whether we could or we couldn't. You see, one of the requirements for us to find out from the state of Indiana as to whether or not we could get a license from them was we had to have a mailing address in Indiana. So that meant we had to rent a space someplace that would give us mailing address. And then we could submit the paperwork, and we could then find out whether or not it's also
Which is fine. But I was concerned about the fact that the structure of the Fort Iroquois Health Department said that you could spend money in Fort and Iroquois counties. Didn't say anything about going beyond those bounds.
Well, over the years, that has had to change. It may not change in the bylaws, but we already spend money outside of Fort and Iroquois County in regards to some of the programs. We have agreements with Livingston County for certain things. We have a agreement with the federal government. You see, as a medical facility, we are not just able to say we're only going to treat you if you're from Fort or Iroquois County. When you have a grant from the government, they send you somebody out of Chicago, you have to treat them.
And while I appreciate that, you were structuring a path to practice in Indiana. To practice in Indiana. That bylaws said very simply that you could only spend the money in Fort and Iroquois County. I understand you can treat people outside those counties for various reasons, but you were moving to the state of Indiana where your bylaws very clearly, to me, said Fort and Iroquois counties.
We were investigating, we weren't moving it.
You had spent money there.
Yeah. All the money that we have in our funds comes from the taxpayers.
Right.
So you spent non-taxpayer funds, which were,
They were money that was earned by the department, money that was profit from some of the grants that we ran, and so forth. That was my understanding of it.
well, I know when I ran a business, if I didn't follow the articles of the corporation, I was either instructed to amend the articles or not practice beyond those bounds.
Well, we hadn't actually been practicing, we were investigating.
We had a building.
But you could spend money. We'll let it go with that. There's no need to argue.
No. Nope.
Anything
Thanks.
else from the board? Matt, maybe a little help from you. State statute and the bylaws. What's the difference for the good of our board?
Well, state statute is what you have to follow. Those are the, for example, most state constitutions, if not all state constitutions, are prefaced on the federal constitution. A local jurisdiction, a state or a local jurisdiction is, or your county, any county, can add changes to the laws. They can make them stricter, they can't ignore them. So they can make amendments that change they can't change the statute, they can add to them.
Can they go out of the state?
Mr. Devine and I looked into that. We got this after it occurred. We were informed what was going on. Got a letter, Mr. Devine and I both got the same correspondence from the Attorney General's office, that there was not a case on point that said they couldn't. Obviously, there's nothing in the statute that says they could. So the issue is still has not been ever litigated or decided. The main issue that I had with Mr. Devine, I don't speak for him, but that he had, was that when you leave the state of Illinois, obviously, local state's attorney, you lose jurisdiction. You can't render, you can't help them in a foreign state. So there was probably one of the problems with us.
Okay, anything else for Mr. Jensen? Okay, thank you for attending. Well, really, the only other thing that I wanted to cover tonight was, I guess, is there any comments that the board would like to make? I know you've had, Mr. Rhodes,
We can't, you're over here.
okay, well, if everybody would stop talking, we might go over there. Okay? The only other thing I want, I guess, is just if there's any comments from the 12 of us that anybody would like to make. And that's really about all that we're going to do for public health tonight. So is there any comments from anybody? Tim, I was counting anybody.
I know. Well, I guess the only thing I can honestly say to this board is, again, like I stated earlier, I'm very, very proud of this board for doing what I feel that we should have done in the first place. I don't know, we all took an oath and everything else, and part of our oath should be part of the Constitution, and our Constitution states it's innocent until proven guilty. We've always demanded facts throughout the whole thing. We never jumped to conclusions. We never let it get tried in the press. I'm very proud of that, the way we conducted ourselves. And I'm very glad to be part of this team. I wanted to thank each and every one of you. And my concerns are for our citizens and my constituents in District 2. I have a lot of people that require the Board of Health, nurses and stuff like that, and I've talked to so many, and I know it comes into question whenever I bring that up, and it has nothing to do with me personally. It has my personal conviction to them to give them the very best I can do. And in my opinion, our Board of Health, nurses and everybody else, the services that they have received has been phenomenal. And I can't thank those nurses enough. The people that I deal with know their nurse's name. They don't know Corbett from Adam. They don't know anything. They know that nurse that comes to their house in the middle of the night or when they need them and stuff like that. And that's what concerns me a great deal, that they will be losing that, and they're scared. As you all know, I'm a District 2 rep. That's the Panhandle. That's all the small towns. A lot of the people don't have access to doctors, health care, and stuff like that. Some of that is their only access to health care, and they're scared if they lose that, they're going to lose their home or have to move closer to someplace else. And as living in a small town, we don't need any more empty homes in these small towns, that's for sure. And it's just another nail in the coffin of a lot of small towns. And again, I want to do everything we can to maintain the best I possibly can for my constituents. I don't know what that is right now, and that's something we as a group are going to have to decide. And again, I wanted to thank everybody for conducting themselves the way we have.
Your constituents.
Thank you very much. Thank you very much.
Yes.
I was just having one comment, Rich. I don't have a conversation about the demise of the Fort Iroquois Health Department has come about. I think we have a situation that we need to factually determine what needs to be done. And I don't think we've gotten near enough facts yet to know what to do. At the same time, I'm not the least in favor of ending the Fort Iroquois Health Department because that's not really the question right now. The question is, there's in another area that we need to get facts about before we can.
We would be losing federal funds and just for saying this on.
I don't even know how that really got started, because I don't think anybody from Ford County has ever even discussed any of that, or do even want to. I don't.
You want to discuss what? Maybe we should.
I think there's been a lot of accusations made in the media and just in general in the county. I'm not sure there's always proof behind them. And I guess my thing is, if you're going to accuse the board of doing something, then let's see the proof, and we'd be happy to look at it.
I think there's been a lot of damage done. I'm not sure if it can be repaired no matter what course of action was taken. I know our probation department uses the services of the health department, and Iroquois County would too. And just to say, anything that happens, if there's a disruption, I don't know if you could even get things back on track in 6 months, let alone a year. Right. That's my line.
I have a question. Mr. Corbett's contract's up in November. Is he going to be reinstated and able to hire people, or is he still froze? Or why can't we wait until then and then not have a contract for him?
That's something that needs to be addressed by the
Board?
health board. We, the 12 of us here, have got 4 representatives on the board, Eleanor, Reverend Jensen, Dr. Brooker, and Dr. Ray. They do a very good job. I've got all the confidence in the world of them, and I'm quite certain they'll do what's best for the citizens of Fort County. So, if there's nothing else, that's all I've got for tonight.
Mr. Jensen, in closing, got a copy of the letter that the Iroquois County Board, Mr. Kopus, the chairman, and the state's attorney sent to IDPH. And I read that letter, and I find it really ironic, and I'd like to quote from a couple of things. You made a comment that you would vote to support Mr. Corbett, or vote to keep him, I think was the term. And this information was presented to you, and you voted for some action in relation to this information. Mr. Corbett and 2 female nurses from Fort Iroquois Public Health Department attended a conference. It was a seminar in Urbana. As the seminar progressed, Mr. Corbett hand wrote on an admission sheet, "Butt pirates." Quote, "No wedding band. Right index finger is in hooked position for fingering his beehole." That's your administrator, Mr. Jensen. You are presented with evidence of the actual handwritten note and first-hand testimony from the nurses during that executive session. Quote, "The nurses' handwritten notes of the incident is enclosed." They provided that to the state of Illinois. You had it at your last executive session. After completion of executive session, the board voted 7-0 to remove the administrator's ability to hire, fire, discipline, or change job descriptions of any employee.
Well, that's a unanimous vote.
It was a unanimous vote, Yet now we're hearing rumblings from the Ford County side of things that they're going to reinstate Mr. Corbett's powers and duties. The very ones that all 7 stripped. Now, Mr. Jensen, you said you would support keeping him, so I'm assuming you're going to support giving him his powers and duties back. I have one question for you, sir. Who in their right mind would vote 7-0 to strip a man of his powers after such disgusting, unprofessional behavior? Who turns around a month later and gives it all back to him without one shred of research or documentation to disprove what those nurses said?
Well, they research topics.
Oh, that's right. That Topics website, that's right. That's where their information comes from. Well, how about this one, sir, that you're so willing to support? Mr. Corbett removed drugs from the national stockpile and passed them out to staff and family members without prescriptions or approval from the nurse in charge of the immunization program.
Hold on, drugs?
Pharmaceuticals.
Is that some of the chemicals that he was accusing Iroquois County State's Attorney of being on?
May very well have been. Now, that was a topics thing that he referenced, I believe. But,
Okay.
You know, that's why we keep referring to topics. That's what somebody put it on that topics website.
Well, that's so much email.
Well, yeah, he quoted the topics
Right here, in this email right here.
Yep, that is the one that he shared with the other board members. Well, those what I would call theft of those drugs, it was reported to the state's attorney Jim Devine and Lynn Reagan from the state and reported as on state audit forms that were enclosed meaning with this letter that went to the state. So it's really amazing. You know, you want to support this guy, but he's stealing drugs and handing them out. It was documented and reported, and although from what I understand, over 7,000 from what I understand, with over 7,000 prescriptions, being that it was a national stockpile, the small number, which my understanding was anywhere from 10 to 20 of these prescriptions that Mr. Corbett took, wasn't enough for them to pursue the cost involved in prosecuting, but doesn't mean something wasn't done wrong. Now, you know these things have taken place, you've been informed of it, so I'm assuming you're just choosing to ignore it. Now, I can't believe for a second that Dr. Brucker, I believe is a dentist in Gibson City, and Dr. Bernadette Ray would ever put their professional integrity on the line to support a person that would do this. And I say that because they voted 7-0 to strip him of his powers. Mr. Jensen, what is going on? What's really the bottom of this here? How can you support this guy? I mean, seriously, tell us. Dispute the record, not your opinions like you expressed the other night. We want the record. This is part of the record, and there's more coming, rest assured. It makes no sense, sir. And as if that's not enough, Mr. Corbett's in charge of that whole administration. What's a common pay raise for public officials over a 2 or 3 year period? If you had to guess, John, what would it be?
3 to 4% a year.
In the military, what kind of percentage were we lucky to get?
2.6.
You know,
1.3.
So let's take a look at Mr. Corbett's track record. Kerry Hagan, you know, the bookkeeper that bounced the checks, received a 54% pay raise over a 3 year period without board approval.
That's a bookkeeper the auditor said couldn't do the books.
Auditor said she couldn't reconcile a checkbook. Got a 54% pay raise. One of your powers and duties by statute there, Mr. Jensen, you folks on that board are to set the salary. In fact, it says to fix the salary of officers and employees of that public body. You're allowing Mr. Corbett free rein to do that with what I would consider discrimination across the board. He has no power by statute to be issuing those kind of pay raises. What do you have to say for that, sir? Next item. Probably one of the most telling parts of this whole letter in relation to what we heard the other night spewing from your mouth, and you are right, you're a preacher and you like to talk. Unfortunately, there wasn't a lot of substance to it. This particular letter to the state of Illinois outlines something very, very intriguing in relation to what everybody keeps spewing that's wrong. The claim is Iroquois County wants to destroy the health department. They want to take services away from people. No, sir, that's not the truth.
The only people I heard say that were the preacher man and the Ford County Board.
Pretty much so. And we've heard it from a few of the nurses and the rumblings that that's one of the things that, you know, Rod Copus is doing, the man that you said lied, but you haven't told what those lies were. You just make an accusation with no foundation to support it. We'd really like to hear it, because if he did lie, we'd like to publish it. You know, that's good information. Do you think he'll ever get that to us?
No.
No, I don't think so either. But in regards to destroying the health department, we look forward to your quick response and help for an early resolution on this matter, as public health is suffering immensely in Iroquois County. Iroquois County believes the above issues are serious infractions and strongly believe corrective action be taken in these matters. However, we are unable to reach a consensus with our partner, Ford County, who to date is unwilling to join us in any remedies. Mr. Jensen, that's a 3-page document sent to the state of Illinois outlining the problem, seeking guidance and direction and assistance in fixing the problem so that the service to the community doesn't hurt. Can you show me one piece of paper that you've written to the state or to the board or to anyone else, or any board members' documentation of trying to fix this problem? No, you can't. And if you have done it, you haven't shared it with the whole board. But that's not too uncommon for you, because you like to have your meetings by email with the rest of your Ford County board members and exclude the very board members that are supposed to be part of the same public body.